First week that we had the education, or the first day even, I feel like we had it in the morning, and then we probably had 9 patients in house, and I think 5 of those patients got Macy's that day. They were like, oh, everyone's getting a Macy. I'm like, well, everyone needs a Macy. So number one thing I feel like we use it for, though, is nausea and vomiting. The patients that come in here are just, they're pitiful with it. It's the worst thing, because to take PO meds to relieve that, it's so hard to do that without having IVs access and all that, or access to the meds necessarily all the time.
Having to turn someone every time you medicate them to give them rectal medications, because they have to get the medication by that route, is distressing to family, because they always leave the room. Have to turn the patient. They may be having a lot of pain that we're trying to get under control. Immediately, the Macy catheter just got rid of that whole situation.
For the longest time, we're trying to explain to family, so we're going to continue to give these, the Roxanol and the Ativan and everything like that. We're going to keep giving that orally. We're going to kind of tuck it in their cheek, and it's going to absorb, and, their symptoms are going to be controlled. But all the while in the back of my head, I'm like, well, it's not all getting absorbed. It's like distressing to the family to see the remnants of this, and we're doing mouth care, but we got to kind of wait to let it absorb. So to be able to take that completely out of the equation, where I know they're getting their medicine, families don't have to see all that when they're not effective orally. We're not tossing and turning them. We're not disrupting them. We're not telling the family, okay, well, we got to medicate now, so I'm going to need you to leave the bedside. I mean, we've got, married couples, been married 70 some years, holding hands, never leaving each other's sides. We want to give them as much time as possible. It could be, their last 10 minutes that they have together, and we're in there trying to make sure they're comfortable, but the way that we don't have to take away that time that they have.
The first patient we put it in was very restless. And I mean restless for several days.
Well, that gal, she was nausea and vomiting uncontrollably for at least 3 or 4 days. I think I'd already started doing meds rectally. I talked to the family. I said, none of these things are working effectively enough for her symptom. So she got one, and then 1 or 2 doses of medicine in, and she's comfortable resting, not retching, not, sick, didn't look miserable anymore. Families were overjoyed that day with the symptom release that we were able to provide, really.
And we were so amazed at how simple and easy it was. And the family was so relieved that she was resting well.
When we're giving a report to night shift, I'm like, okay, well, they're probably a day out from a Macy. Or, I kind of give them a time frame, like, this is what I feel we should be doing with them. And if I'm going to be gone for my 2-day, 3-day stretch, I honestly, if I see that in the next 12 hours, I try to place one before I leave.